Hello, everyone. Amanda, CEO and co-founder of Bari Better Inc., where we provide online bariatric coaching in English and Spanish and Portuguese. And today I am interviewing Dr. José Diego Botezelli. He has a PhD in metabolism and physiology. And today we're talking about bariatrics and exercise. So thank you so much, Dr. Botezelli, for being with us in our second segment of today's interview. And I would like to talk to you and ask, what is actually the importance of physical exercise now after clients have already gone to the bariatric surgery, no matter what kind of bariatric surgery you had it done?
Essential. You cannot have a successful strategy like after bariatric surgery if you don't do exercise. And the reason is, when you do the bariatric surgery, the gastric bypass, what happens is you lose a lot of weight, but as you're not eating that much, you start to lose muscle. So if you don't do exercise to prevent this muscle loss, what happens is your metabolism will start to reduce. So our muscles, it's like our engines, like a car engine, right? Bigger your muscle, more fuel you consume. So imagine if you see a bodybuilder, the guy's pretty big, they buy like 300 pounds of, pretty much like 200 pounds of pure muscle, right? They need to eat 5, 6, 7,000 calories a day. So if you don't do exercise, if you don't start to perform exercise after a bariatric surgery, your metabolism will start to decrease. Why? You start to lose muscle. Our muscles, we need to exercise them to keep them. This is really easy to see if you break a bone or see someone that breaks a bone and put a cast. After just 4 weeks, when they set up the cast in the hand, for example, or the arm, it's pretty tight, the cast. After 2 weeks, you can see that you can stick like 2 fingers. You can sneak 2 fingers between the cast and the arm. Why? You are losing muscle mass because you're not using that muscle. And then we start to reduce our metabolism. So one of our first conversations, you send me your bioimpedance, which is analysis that will check your body fat. And although you're losing...
Elaborate a little bit more on bioimpedance, because a lot of my clients, we don't need to go into deep details, but a lot of my clients say, I had my bioimpedance done, or sometimes they know that they had something done. A lot of times they don't have the explanation or they don't have the deepest understanding about it. So like in a general information, I remember one of the sessions I had with you, you went over with me. I totally understood my numbers, and that made so much sense to me. And then we totally revamped my exercise program, and I needed, because I was losing a lot of muscle mass. And then you went, into detail and explained to me. So please clarify a little bit to our viewers and listeners, because people need to know that.
So this kind of analysis will check the amount of fat, muscle, and water. Pretty much, like some of them, they check like other things, like bone density and those things. But usually what the main numbers are body fat and lean mass, okay? So body fat, our fat doesn't spend that much calories per day. It's almost nothing because it's just a storage, right? It should not like spend energy. You don't want to spend energy inside of like a place that you store energy in a place, in a kind of cell that we spend energy, right? So the fat mass, more fat mass you have, usually lower your metabolism. Higher lean mass, higher metabolism. So what happened in the post gastric bypass? Usually because people...
Bariatric surgery, right?
Yeah, bariatric surgery, right? People start to lose weight a lot, but if they lose like 30 kilos, for example, usually this will be 15 kilos of muscle and 15 kilos of fat, or 20 kilos of fat and 10 kilos of muscle. So you're reducing your metabolism and gets harder and harder and harder. So if you read your bioimpedance and your levels of fat, it's over 30%, means that you're obese. Okay, and for men over 20%, let's put 20% of that, and 30% for women, it means that you're obese. Okay, so I see clients, not bariatric, but I see like many clients, they're lean. They in weight, like speaking about weight, they're lean. But when I check the body fat, they have body fats around like 34, 35%. Actually, they're obese, because obesity, it's not your weight. If I get a bodybuilder, for example, he's pretty big. The guy is maybe like 200 pounds. Me, for example, when my weight reach like 185, I'm considered myself using the BMI overweight. okay, because of my height. But my excess of weight, it's not fat, it's just muscle. Okay, I'm still healthy. But if I'm leaner and have more fat, this is the bad. That's the best. This is the bad scenario. Okay, so the bioimpedance is so important because we'll show how much fat you have and how much muscle you have. Everybody wants to lose fat. People don't want to lose muscle because muscle is so hard to get. It's so hard. You need to work out. You need to eat properly. You need to eat clean. You need to do exercise all the time. Okay, but fat is pretty easy. You just need to sit in front of your TV and eat. That's how easy to get fat. We want to lose fat. So the exercise after the bariatric surgery, what the exercise will do, it will prevent this muscle loss. Okay, I remind to tell you this: when we start our strategy, your weight was pretty stable for like 6 months, almost 6 months. Your weight was pretty stable, and you were saying, Diego, my weight's stable. I'm not dropping my weight, but your measurements, remember your clothes, your measurements were always reducing. Why? Because muscle is way more dense than fat. So you start to get small and small and small. While you start to, because your muscle mass was pretty good, and this is not just you, this is like normal, like many bariatric surgery, like bariatric patients that I have, they usually when they come to me, it's like, Diego, I did this bariatric surgery 5 years ago, 6 years ago, I reached a plateau and I can't lose weight anymore. And what I say using bioimpedance or adipometer, another measurements that I have, it's because they have too much fat and almost no muscle anymore because they're starving themselves. They're not doing exercise. And then I'm pretty honest. I say, okay, we're doing this strategy. Don't look your scale for now. We are doing this strategy here. And you see by like in 4 or 5 months, your scale will not change that much. But your clothes, they're your best friends. They will show you that you're losing weight, right?
Not only that, but I have to say something. I remember when I met you too, we were talking about like, my muscle loss that was really impressive for me. And just like sitting on the chair, it was hurting my bones. Like I could feel my bones. And I remember working with you, just like getting, better protein intake and strategies that you use with my plan. Huge difference. Huge difference. Absolutely.
Yeah, and that's a good training after. It's good to have aerobic like endurance exercise, so it can be a walk in a fast pace, especially in the first like couple of months, because if you went through a bariatric surgery, it means that your weight's a little bit like higher. So it's better if you do a spinning, like elliptical, these equipments that will not have the impact like walking or running that will overload your knees or hips. And this is actually a good point for the previous topics, like why I should do exercise before the bariatric surgery is to prepare your body, right? So if you do the exercise and then you do the surgery, like 2 months later, you get back on track to the exercise, your body is already kind of like prepared for that. So you have a muscle memory, a joint memory there that will improve pretty fast. You gain muscle pretty fast again. And this will protect you against those plateaus that we see all the time. So people lose weight and then they can't lose weight anymore. And I have a client. I'm not kidding. She was not eating like 800 calories per day. She was not eating she was eating like nothing per day, and she was not losing weight anymore. Why? Because she did not have muscle. She could not spend energy. Her metabolism was so low that even eating so little amount of foods, she was not losing weight, right? Because you lost your energy.
Bariatric is not a miracle. It's a tool. And a lot of people think that after they have the surgery done, they can eat whatever they want. Or some people, they say, well, I'm not going to eat it because then I will, release the weight. And that's also not the fact, just like you're saying. So yeah, very important to know what to eat and eat right.
Your body will start to become a Toyota Prius, like super, super, super efficient. You don't spend energy anymore. It's a pretty small engine, right? And again, evolutionary speaking, this is reasonable. This is what evolution would like to do with us, because in nature, usually I say you don't have a grocery stores across the street. Okay, in the nature, your body wants to like hold energy all the time. Your body doesn't want to spend energy. You don't have food all the time. If you want food in the nature, like go camping and don't bring food. okay, you need to find your food. You see how hard it is to just feed yourself for the day. You sleep like hungry because you need to hunt. You like all the food that you see, like plants, herbs, fruits. They're so tiny, they're so small, they don't have sugar. It's super hard to eat, right? So we have this mechanism that help us to get here, while like where we are now, okay, but like saving energy, it's so important for us. It's like evolutionary, it's a survival process that will try to hold up energy all the time. And exercise, you keep your muscles, so you won't lose muscles, right? And also you spend more calories. This will help you to lose weight in a really healthy and stable way. You see, will boost your losses, okay? And then we have like a protein synthesis. We have like a better signaling. Your hormones will start to work better. Like our muscles, they release some hormones, some like cytokines that will help your metabolism. So all those things, they will make you more happy. They will make you more efficient. They will make you stronger. All these changes. Remember, bariatric surgery, as Amanda said, is just a tool. Okay, it's just a tool to make the things, like to make things happen. But you need to make things happen. Okay,
Exactly.
that's the point.
Can't do that for you, but you.
Yeah.
Absolutely. And that's one thing that I tell my clients to all the time. And this was a great segment, and I really appreciated your thoughts on pre and post bariatric exercise, because that's something very important that you and I talk about bringing to our viewers and to our listeners. And to close up in this in our segment here, I want to remind people about the bioimpedance, because it's something so important that I had the knowledge about it. For me, it was very important that I actually had my bioimpedance done before my surgery. And I remember even like a year after my surgery, when I kept going to my post-op, and I tell my clients, check with your doctor regarding, where your possibility for exercises, and also keep going with your bariatric multidisciplinary team, because they know your goals, they know where you have to be, right? And all that. And then, we follow through with the coaching bariatric, and with, people like you helping with the exercise and the planning, the nutrition, and so forth. But it's very important that people understand. And just in case if you do not know what a bioimpedance means, or if you don't know if you had that done, mine was done actually on a scale. I actually stepped on a scale, and the way that my doctor's office I actually had to put my hands on the handle, and it's a little machine that I listened to a little song for a quick second or a minute or so, and then it checked all these numbers in my body. I'm just saying in a general way for people to understand. So some places they have a smaller machine, play some different one, or you can right.
Buy one online. They're super cheap. You pay like $40, $35. They're not as accurate as the ones in a clinic, right? But they do the job. Okay, you have a deviation like a 3-4% error. That's almost nothing. You have an app in your phone. Most of these new scales now, they connect to your phone, and with the phone will show if your B is like, how is your fat. We'll give you the levels and everything. And this is amazing for us. We give you all the interpretation. It's just an app. It's like $40, right? Yeah, these clinical scales, they're like $4,000. Do you need? No. Just go online. Super easy. It's a bioimpedance scale or type body fat scale. It's amazing. You can do it.
After I have all my sections with you, I do have one at home, and that's how I weigh myself, and you can get all my numbers. So that's the beauty of online services, that I can send it to you no matter what part of the world you are, and you can see, and then you can give my exercisings accordingly, which is so important. So everybody keep up, exercise if you can, and don't forget pre-op or post-op after bariatric surgery. Thank you so much, Dr. Botezelli, for the segment. And now we're going to go to our segment number 3. I appreciate your time. Thanks for being with us today.